Hey everyone, my name is Mildred Min. I'm an integrative dermatology research fellow with Integrative Skin Science and Research. The study I'm going to be presenting today is soy protein containing isoflavones improves facial signs, photoaging, and skin hydration in postmenopausal women. These are the results of a prospective randomized double-blind controlled trial. This is the full author list as well as the respective affiliations. To give a bit of background, plant-derived isoflavones are non-steroidal compounds that resemble estrogens and thus are able to bind ER-alpha and ER-beta receptors. As a result, they are able to exhibit wound healing, anti-inflammatory, and chemoprotective properties. They also mitigate some of the hormonal shifts that happen in postmenopausal women by reducing DHT levels. The main dietary source of isoflavones in humans is soybeans, and soybeans contain daidzein and genistein. Food-based interventions and nutraceuticals have become a booming industry in recent years because people are very interested to know if foods can have anti-aging effects. For example, tomatoes and mangoes contain carotenoids and have been shown to decrease wrinkle severity, and almonds contain alpha-tocopherol, a form of vitamin E, and they have also been shown to decrease wrinkle severity. Soy isoflavones act as an antioxidant, scavenging free radicals that accelerate photoaging. They also reduce hyperpigmentation by inhibiting melanin transfer from melanocytes to keratinocytes. They also increase collagen synthesis, thereby decreasing the appearance of fine lines and wrinkles. Preliminary studies have shown that soy isoflavones, in addition to other added ingredients, can decrease wrinkle severity. Our study aims to add to that literature and also standardize the investigation of soy isoflavones in the form of a soy protein isolate with added isoflavones termed SP2. And we wanted to see its effects on photoaging and skin biophysical measures in particularly postmenopausal women. This study was 6 months long. It was randomized, double-blind, and controlled. There were 5 visits at screening, baseline 8, 16, and 24 weeks. Subjects received either SP2 or casein protein in a 1-to-1 fashion. And we ultimately randomized 44 postmenopausal women with Fitzpatrick skin types 1, 2, and 3. Study procedures included high-resolution facial photography, as well as measurements of skin hydration and sebum production. Here we have 2 figures representing average wrinkle severity and average pigment intensity in the 2 groups over 24 weeks. On the left, you can see that the soy group experienced more significant reductions in wrinkle severity at all time points, but had statistically significant differences from the casein group at week 16 and week 24. On the right, you can see that there were variable differences in week 8 and week 16 for both groups in pigment intensity, but at week 24, the soy group experienced a statistically insignificant decrease in pigment intensity compared to the casein group. Here we have the hydration and sebum production measurements. On the left, you can see in part A that the soy group experienced a statistically significant increase in skin hydration at week 24 in both the left and right cheeks. However, the casein group did not experience any significant differences in any of the time points. On the right side, you can see that sebum production there were no significant differences in sebum production in either cohort at any of the time points. In part A of this figure, you can see the soy participant at baseline, and in B, you can see the soy participant at 24 weeks. And on the bottom row, we see C baseline and D 24 weeks for the casein participant. In conclusion, our study shows that in postmenopausal women with Fitzpatrick skin types 1, 2, and 3, dietary soy protein supplementation decreased wrinkle severity by 5.9% at week 16 and 7.1% at week 24, decreased pigment intensity by 2.5% at week 24, and increased skin hydration by 39 and 68% in the left and right cheeks, respectively, at week 24, and there were no changes in sebum production. Overall, our study shows that food-based interventions such as soy protein supplementation with added isoflavones may be an appropriate integrative approach to combating signs and symptoms of photoaging and other skin biophysical properties. These are our disclosures. This is my contact information for any additional questions. Thank you.